All right, so good afternoon, everybody. Welcome to the November Wellness Webinar. I'm Laura Maloof Miller, a Wellness Program Manager with HealthNet. As you heard, Kristen Kayla is also on the line. She's a Health Promotion Consultant with HealthNet. So we're both kind of sharing the host role today for this webinar. Just a couple of housekeeping items to remember before we begin. Everybody's been muted upon entering the webinar, and of course that's to avoid any background noise. However, if you wanted to change your audio settings, all you need to do is simply click on the join audio icon. And also at the end of the webinar, there will be a 4-question anonymous survey. Elise, if you can switch to the next slide, please. All right, so if you're having any technical difficulties during the webinar, feel free to chat myself or Kristen. You'll see an opportunity there to chat the host or the panelist role. So all you need to do is open the chat box. You simply hover over the Zoom toolbar. Could be at the bottom, at the top of your screen. So you're going to see a chat box icon there. You simply just need to click on that, and we will receive your messages in real time, and we'll respond to your message in order that we receive them. Also, if you are attending this webinar and you happen to be in a conference room, or you used a single webinar access with your team, if you could please chat that number of attendees, that would be great so that we can get a more accurate number on attendance. And if you could, yeah, perfect. Thank you, Elise. Just keep in mind, this information provided in this presentation is intended solely for the general information of the audience. Today is a diabetes topic, but please remember that this is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you happen to have any health-related questions or problems, we would ask that you please seek the advice of your physician or other qualified health provider. All right, so our topic today is diabetes. This webinar is brought to you both by HealthNet and our partner, John Muir Health. Today's topic is diabetes, so please welcome our presenter, Claudia.
Hi, thank you so much for having me today. My name is Claudia Graich-Vasquez. I'm a registered dietitian, nutritionist, and certified diabetes education support dietitian, and it's a great time to have me. November is National Diabetes Month, and our focus this year is on education. So definitely the more you know about diabetes, the better off you'll be. So just quickly, the class objectives today, I'm going to define prediabetes and diabetes. We'll look at risk factors, discuss lifestyle approaches for you to prevent or delay both prediabetes and type 2 diabetes. A quick mention on some medications that are being used for diabetes prevention, and of course, just the main ingredients for prevention success. All right. So the scope of the problem, you've probably seen a lot of these statistics before. It's definitely a huge problem. Most of us know someone with diabetes or prediabetes, or work with someone or a family member. And, you know, if you've recently been diagnosed with diabetes or prediabetes, you're not alone. We know now that there are more than 88 million people in the United States with prediabetes. So about 1 in 3 adults have prediabetes. The diabetes statistics are just equally as staggering. You know, it's like I said, most of us definitely know that, and the numbers continue to go up. As our rates of overweight and obesity goes up, hand in hand, you're going to see an increase in prediabetes and diabetes as well. We have an epidemic of both conditions on our hands here in the United States. We find that the rise of prediabetes and diabetes in the United States and the world are due in part to a large increase in numbers of adult and children who are overweight. People are more sedentary than ever. So, you know, our activity level over time, over these decades, has definitely gone down. The population is aging, so people are living longer, and older adults tend to be more glucose intolerant. And as well as the number of people from certain ethnic groups, which have a higher incident of diabetes symptoms, is growing in the United States. So that includes African American, Hispanic American, Native American, Asian Americans, and Pacific Islanders. Next slide, please. So quickly, what normal blood sugar control is, or blood glucose. Glucose is just a fancy word for blood sugar. When we eat food, we digest it, it gets broken down to glucose. So glucose, again, is that fancy word for blood sugar. It's what fuels our body. It fuels our muscles. Every cell of our body requires glucose. Our brain requires glucose. And you'll see here, there are other organs and body parts that play a role in normal blood glucose control. Now, when people start to develop some glucose intolerance, you may see where our liver, for instance, which stores and releases glucose during, between meals and in the overnight period to keep us stable, it may be releasing too much glucose. And the pancreas, which makes the hormone insulin, which I'll explain in a couple slides, it is the key that unlocks all of our cells and allows glucose to enter the cell. Perhaps that key isn't working like it used to work. So we end up with a buildup of glucose in our bloodstream, which is not good. And then, like I said, all the body cells in the body require glucose for them to function properly, and our muscles like glucose as well. So next slide. So this is what happens. This is normal glucose metabolism. So you can see on the left there is your cell. Glucose is in the bloodstream. Insulin gets released from the pancreas. It unlocks the insulin receptor, which is a glucose channel, and allows that glucose to be taken in by the cell and then function properly. Next slide, please. When we become insulin resistant, like I said earlier, for some reason, those key or that insulin hormone just does not unlock the cells like it used to. So all of a sudden, the muscles can't take in the glucose, nor can the brain, or all the cells in the body, and we end up with a buildup of excess glucose in our bloodstream, like our cells become resistant to the action of insulin. Next slide, please. So how do prediabetes and type 2 diabetes start? The body cells, like I said, can tend to develop this insulin resistance. And insulin resistance, these are when the cells in your muscles, your fat, and your liver don't respond well to the insulin and can't take that glucose up from your bloodstream. As a result, then your pancreas starts to make more and more insulin to try and help get that glucose into the cells, but it's just not working. So again, you develop this excess glucose in your bloodstream, and your pancreas, sometimes we call it the pooped out pancreas, it gets tired and it slows down. And how we see this is through lab work. Usually first, we start to see that the blood sugars start to rise, or people may just feel a little sluggish. Next slide, please. So again, you can see the buildup here of the glucose in the bloodstream, and that can be damaging over time. If I were teaching you in a class live in person, I would have a couple test tubes, one with what normal blood looks like. It's pretty fluid, moves like water. And then I would have a test tube with, fake blood, but blood in it. That's more like syrup or honey. It becomes really thick and sticky. And that is what can do damage to our small blood vessels and some larger blood vessels over time. Next, please. So what are our risk factors for prediabetes and type 2 diabetes? Some are within our control and some are out of our control. So just a quick run by here. So being overweight, especially around the waist area, we used to call this an apple shape. that area can be dangerous to carry extra weight because that's where some of these organs are located. And what you'll find out in a little bit is that having excess fat in the body is like a barrier for that insulin to do its job correctly. We can't prevent getting older, so being 45 years and older is a risk factor. Like I said before, being more sedentary, if we have a family history, especially a parent or a sibling with diabetes, some of those high-risk ethnicity groups, that I mentioned earlier. If you had diabetes during pregnancy or gestational diabetes, that is a form of prediabetes and increases your risk of developing type 2 diabetes later on. If you have a history of higher blood sugars, high blood pressure, low good cholesterol, which is your HDL, high triglycerides, which is the type of fat in the bloodstream, maybe a history of cardiovascular disease, and there are also some medications that could increase your risk. Next slide. So why should we worry about prediabetes? Because what I tell a lot of my patients is prediabetes is like a little red warning flag. It is something for us to take notice of, and we can start to make changes in our diet and lifestyle before we convert over to diabetes. So the good news here is that if you have prediabetes, you can make changes and you can reverse it. So you can go the other direction. You can, have your prediabetes disappear if you make some changes. Once someone converts over to diabetes, type 2 diabetes, that stays with you. You can it's a manageable disease and you can control it, but it won't go away. Next slide, please. So our screening tools that we use for prediabetes, most folks get screened at age 45 or older. If you have an at-risk weight plus another risk factor, your doctor, physician, caregiver may want to screen you, and it would be repeated at least every 3 years. But from what I've seen, most primary docs, nurse practitioners, etc., they are checking a fasting glucose every year if you're getting an annual visit, or this could be done at a health screening as well. Next. So, what kind of warning signs would you have if you were developing diabetes? For a lot of people, it's none at all. They don't feel any difference. So a lot of folks don't see the doctor regularly, and they may have had prediabetes or diabetes for a long time and not even known it. But these are some of the symptoms that are more common that we've all heard about. You may be feeling unusually thirsty, using the restroom a lot. You may be tired all the time, which for those of us who are getting older, this just seems like normal. I'm always tired, but maybe there's something else going on. When people's blood sugars are pretty high, they may experience weight loss without trying, vision changes, frequent infections or heat, and perhaps numb. Next slide, please. So how do we diagnose prediabetes and diabetes? You can see here, a lot of times it's done with a fasting blood glucose test. You can see the normal would be under 100 or 99 and below. A diagnosis of diabetes would be higher than 126 on 2 occasions. And then you see the prediabetes zone. So that would be a fasting blood sugar between 100 and 125. Again, that's our little red warning flag. Some doctors, primary medical doctors, they are using the A1C test, which I'll talk about in the next slide. And you can see the numbers right there of what we're looking for. Next. So the hemoglobin A1C test is a test, it's just a very simple blood test. You don't have to be fasting. And it measures your average blood sugar over the past 3 months. It's a hemoglobin molecule, and blood sugar attaches to it normally, but we'll see an abnormal amount of glucose attached to that cell. And that's where we get that number from. And if you could show me the next slide, please. So a normal A1C would be 5.7 or less. The estimated average glucose is on the right in the gray, and then the A1C number is in purple. A lot of times I'll see someone who is newly diagnosed, they may have an A1C of 14 or 15, so their blood sugars have been running extremely high. And thankfully, they went to the ER, saw their doctor, they can get some medication and treatment and come see us. And then we slowly work with them to lower that A1C back into a more healthier range, and they feel a lot better. Next. So prediabetes, again, this is your blood glucose level are higher than normal, but not as high as type 2 diabetes. These people are part of the ticking clock hypothesis that indicates that physiological changes are taking place today, even though they may not feel it, but it will definitely affect their health later on in life. So prediabetes, again, is a condition that raises the risk of developing type 2 diabetes as well as heart disease and stroke. But the good news is, like I said earlier, think of it as that little red warning flag, and that prediabetes is reversible. And which I'll be talking about a little bit later on, is how a healthy diet, healthy lifestyle can make a huge difference. Next slide, please. Just quickly, the different types of diabetes. So type 1 versus type 2, they are actually two completely different diseases. Type 1 diabetes is an autoimmune disorder. People with type 1 diabetes no longer make insulin. They need to take insulin every day to survive. It's usually diagnosed in children and young adults. Type 2 diabetes, more common form of diabetes. Again, the body cells have become insulin resistant, or the pancreas poops out and suddenly they just have higher blood sugars. It's usually diagnosed in adults, but we do get teens and young children with type 2 diabetes as well. And then again, gestational diabetes is diagnosed during pregnancy. It's usually caused by insulin resistance from the placental hormones, and it does increase your risk for type 2 diabetes later in life. So complication of prediabetes is heart disease. So, when I'm working with my diabetic patients, not only do we cover the diabetes and prediabetes information, we also talk about keeping a healthy heart. So because you're at higher risk for developing heart disease, which is also called cardiovascular disease, refers to a group of diseases or conditions that affect the heart and blood vessels. So examples of that would be a heart attack or high blood pressure or a stroke. So I'm going to be talking more about being active and healthy eating in just a few minutes. But again, I always like to stress how important it is to be screened for prediabetes or diabetes. Next slide, please. So the complications of prediabetes, heart disease again. Here we go with screening again. So hopefully your physician or primary medical doctor is on top of this. So having your cholesterol checked at least every 5 years until the age of 40, and then it's every year. And most medical appointments that we go to, we have our blood pressure taken. So it's good to know what that is as well. And here are just some targets for cholesterol. Next, please. So is type 2 diabetes preventable? Yes, it is. So we know that diabetes prevention is proven and possible and powerful. So I know that this first part of the class can be a little shocking or a little hard to hear, but for the rest of this class today, this presentation, I'm going to, discuss more of the good news. And this, the good news is that there is a lot that you can do. You can avoid developing type 2 diabetes with small changes in your lifestyle. And this concept was proven by the Diabetes Prevention Program, which I'll talk about next. And that's, I try and teach my patients who with prediabetes or diabetes and just remind them that, diabetes, again, is a manageable disease. There's so many diseases out there that are hard to control, but diabetes is one that you can control with your healthcare team. So the diabetes prevention program, this was a major clinical trial. We were looking at whether diet and exercise or medication, metformin or glucophage, which some of you might be familiar with, could prevent or delay the onset of type 2 diabetes. So there were a couple groups. There was the intensive lifestyle intervention group. There was the metformin, so taking that medication. And then there was the placebo group. Next. So the findings of this study were that, excuse me, lifestyle intervention worked the best. So by making these small lifestyle changes, you could reduce your risk of developing type 2 diabetes by 58%. So that's really huge. But I do want to note that metformin was also effective by 31%, which is significant. And I know it's used often in Europe for people with prediabetes, and we use it a lot for people with diabetes. It has very little side effects. So that's just something good to note. It was definitely less effective in the elderly and those who were less overweight. All right, but just, remembering that the key for preventing cardiovascular disease and transitioning from prediabetes over into diabetes is that healthy eating and being active, so that nutrition and exercise are powerful prevention tools. And compared from now and going back 20 years when I first started working as a dietitian, my focus was more on healthy eating, losing some weight, being active. And now I definitely talk to my patients and clients about managing their stress. We work with their medications. Sleep is a big part of overall health and wellness and have an impact on your blood sugars as well. Next. So what about losing weight? A lot of folks may have a lot to lose. Some may just have a little bit to lose. I always like to take it low and slow with my patients and clients. And we know, and we have the evidence to show that for some people, losing just 7%, even 5 to 7% of your current body weight can help your body use its own insulin better. So I just, gave some examples here. I never want this to be too daunting. A small amount can have a huge difference. So again, think about, if perhaps you carry that excess weight around your middle, losing, 5 to 10 pounds can make a big difference. It will allow your body's own insulin to work better, to get through to those cells, unlock them, and allow the blood sugars to be used properly. Next. All right. So how do I lose weight? This is the question here. What is the magic solution to losing weight? Everyone wants it done quickly and easily, and it's not that easy. And like I said before, doing it low and slow is the way to go. So, eating healthy and moving more, and we're going to talk about this a little bit. I also want to point out, and I referenced it in the back of, or in my reference slide at the end, through heart.org, which is the American Heart Association. They have a really great section called Life's Essential 8, and it talks about being more active, eating better, getting healthy sleep, how to manage your weight. So they have really good references there as well to help you if weight loss is a goal and really working on prevention. Next slide, please. So healthy eating, what does it mean? So eating more whole grains, vegetables, fruit, fiber. So those are actually all examples of fiber. Fiber keeps us full. Fiber blunts the post-meal, so your after-meal blood sugar response. So if you eat a meal that has a lot of fiber, it takes a long time to digest. We don't see the high spikes in blood sugar afterwards. Healthy fats, just not too much. Fish, foods with omega-3s, getting enough water in, and trying to eat less of the items listed here. So the red and processed meats, unhealthy fats, so those would be your saturated fats, less desserts, snack foods, salty foods like chips and crackers. It doesn't mean you can't eat these foods. We just want you to eat less of these foods and more of the foods on the top listed. Next question, next slide, please. So eating more fiber, I always joke that fiber is a dietitian or this dietitian's favorite F word. No matter what talk I'm giving, I always put a lot of focus on fiber. It's good for your gut health. That's a big buzz area right now in the nutrition world. And it's really, really great for diabetes, for blood sugar management, and for weight loss, because again, these are foods that are going to help you feel fuller longer. And that's what we want going from meal to meal. So there's the two types of fiber here listed. They are both extremely beneficial. So you can get some great ideas here on how to increase your fiber intake on a daily basis. And if this is new for you and you're suddenly going to start eating foods higher in fiber, more fiber, you also want to make sure you're drinking plenty of fluid, mostly water. That's going to help that fiber move through correctly in your system. Next slide, please. All right, so what foods have fiber? Plant-based foods. So plant-based is definitely a buzz term in these last couple years, and dietitians will get behind that. So all sorts of vegetables. There is no bad vegetable, no bad fruit. They can be fresh, they can be frozen, they can be canned, any which way you can get them. We just want to see them on your plate. So for vegetables, I usually encourage 2.5 cups a day or more. For fruits, I'm hoping for 2 cups of fruit or more a day. When you're choosing your starchy foods, look for whole grain breads and cereals, whole wheat bread, pasta, muffins. Corn tortillas are considered a whole grain versus flour. Oats, oat bran, you can just get a nice mixture. Beans and legumes, the pulses, very, very important. They have wonderful fiber. They have protein. They're great to throw into a salad. They're very filling. So 1 cup of cooked lentils has over 15 grams of fiber. It's excellent. And then all of these seeds. So we see, chia seeds and flax seeds and sunflower seeds and pumpkin seeds, all very great for you, high in fiber. They contain the omega-3 fatty acids. Just make sure those flax seeds are ground. So you can buy them ground, or if you have a grinder at home, you want to grind them up to release all the good nutrition that's in them. Watch out for the term made with whole grains. You might see that on a box of Lucky Charms. They're just using a pinch of it in order to put that on the outside of the box. You really want to look for the word whole wheat, or there's even a stamp from the Whole Wheat Council that you may see, and you can check the fiber content on the nutrition label. Next, please. So how can I increase fruits and vegetables? So here's some tips. A lot of times I'll show a picture of a plate, and I would like half that plate to be nice and colorful. Cooking vegetables in new ways, getting cold vegetables all week long. I always make extra so I can throw them in my salad or whatever I'm eating the next day. Fruit makes a great snack in between meals. If you want your children or your spouse or yourself to eat fruit, cut it up. Don't send the whole fruit. That whole fruit will take a nice field trip and come back. We want everyone to eat that fruit. So a good trick is just cutting it up the morning of or the night before, putting it in your little plastic bags or Tupperware and sending it off, and then we will eat it more likely. I love, dipping veggies in salad dressing or in hummus. You can do celery with peanut butter. There's so many ideas here. Next. So choosing healthy fats, just not too many, because it is, of course, just higher in calorie. But what are your heart healthy fats? So they're mostly from plant. So we have all oils like olive oil, canola oil, sunflower, soybean, corn, even peanut oil, avocado oil. Those are all wonderful oils. I like to have a variety in my pantry, and then based on what I'm cooking or baking, using, the flavor profile, or depending on how the heat of what I'm cooking, having a variety of nuts and nut butters, those seeds that I mentioned before. If you like fish, aim for having it 2 to 3 times a week. Also great, again, for that heart health and brain health. All of these items listed here. If you are not a fan of fish, you can get those omega-3s from walnuts, that ground flaxseed, and canola oil as well. Next. You want to limit or avoid the unhealthy fats. So we're talking about saturated fats mostly. These are harder and more unhealthy for our heart. So I encourage my patients to eat more lean meats. So look for the loin cuts or the round cut. Again, try and get, if you like fish, try and serve it 2 to 3 times a week. If you use a lot of poultry, it's fun. Here comes Thanksgiving, but that's every once in a while. It's always great to cook the bird with everything, the skin intact. It helps retain the moisture. Just maybe before you eat it, take the skin off. That's where a lot of that fat is. Saturated fat's going to be listed on your food label, so you can look and try and find items with the least amount of saturated fat. I do want to point out that there are 2 plant oils that are very extremely high in saturated fat, and that's coconut and palm kernel oil. So those are 2 exceptions to the plant-based oils. They are actually higher in saturated fats than butter. So just keep an eye on those. And if you can, keep those low. I know a lot of people like to cook with coconut oil or coconut milk, depending on the recipe. And I think it's fine to have that in your pantry, but don't exchange your olive oil for coconut oil. I would keep olive oil, using that more often. We know how great that is for the heart, and just use the coconut on occasion. And just, again, I believe you'll get a copy of these slides, but we want to use, try and use more low-fat cooking methods. I use those nonstick sprays all the time. And, you can always cut back on the amount of oil that's called for when you're cooking or baking. You don't have to eliminate it, just cut back a little bit. Next, limiting your added sugars. So again, very important when we're talking about diabetes and prediabetes, but I talk about this even with the general public as well. In these last 2 years, added sugars have been added to the nutrition facts label. So this is a really, really good news. These added sugars is what's added to the recipe or to this food product. And the food industry used to be very tricky. They would use all different types of, I think there's over 100 names for sugar now that they could use. So before, we would instruct people to look at the ingredient list and become food detectives. Well, now you can just look at that nutrition fact label and scroll down where it says added sugars, and we want to keep that nice and low. So again, sugar can go by so many different names, but limiting those added sugars. We do know that added sugars not only contribute, to more sugar in the diet and can raise our blood sugars, but it's also not good for our heart. And so that's why, again, when you go to the heart.org website, they will give specifics on how many added sugars a day you want to try and stay under. So you could always cut the portion you add to foods, beverages in half. When recipes, when you're baking, you can experiment with cutting back on the sugar. I do that all the time. Sometimes it works, sometimes it doesn't work as well, but you can play around with that a little bit. And instead, like using extra flavors to boost using extracts to boost the flavor, like vanilla extract, almond, and orange. I think when it comes to yogurts, besides drinks, I think yogurts are a really, really huge source of added sugars in the American diet, especially obviously flavored yogurts. So that would be where I would want you to turn and look at that nutrition label and try and find yogurts with the least amount of added sugars. Plain yogurts are great, whether you like traditional or Greek. And that's where you could add some vanilla extract and then add your own fruit to that yogurt. And you're going to make a much healthier yogurt, and it has a lot more fiber in it. So it'll tie you over longer. So you can check off a couple check marks there for your fruit and your calcium intake. Next, please. So, eating using less fat, less added sugars, this leads to less calories going in. So making some of these small changes, this adds up over time. So for a lot of the folks that I work with and the classes that I give for diabetes, we set small goals each week or every couple weeks, and it's not as noticeable. So they're not making drastic changes, they're making small changes that add up. And then they do see the scale moving down into the right direction, and that's what we want. So again, fat is still fat. So those nuts and seeds, like I mentioned before, are really good for you, but too much of them at the end of the day is going to add too many calories. So these are also areas that we work with our patients in finding that right balance. I also, every class and every talk that I give, that third bullet point is I don't eat fruit because it's full of sugar. And the patient may have even been told this by their physician or a friend or a neighbor or something that they read online. And that breaks the dietitian's heart. So fruit has natural sugar compared to those added sugars that I was talking about before. And the body just processes that differently. What else are you getting with fruit? You're getting fiber, you're getting vitamins, you're getting minerals, you're getting antioxidants, all the things that we know are very healthy and that we need to eat more of. So even for my patients with diabetes, fruit is not off limits. They may just need to be a little more careful about how many pieces of fruit they eat at one time. And instead we spread that fruit out throughout the day, and it works a lot better. Next slide, please. So how should you plan your plate? I mentioned this earlier, and I believe I have a picture of it coming up. Using the plate method. So making half of your plate vegetables and fruit. So lots of color. Splitting the other half of your plate into quarter. So a quarter of your plate could be your carbohydrates or your starchy foods. Even my patients with diabetes, they do not have to stop eating carbohydrates. They may have to just decrease the amount that they're eating and balance it with these other foods. They get a lot better post-meal blood sugars that way. And then that other quarter of your plate, you want that to be your lean protein. So protein is your chicken, your lean beef, your fish. If you're vegetarian, this would be your tofu or your tempeh, your Impossible Burger, your beans. Having that balance on your plate, very important for blood sugar control, for people who want to lose weight, for just making sure you're meeting all of your nutritional needs and getting all the nutrients that the body needs. And then you can always add a small serving of a low-fat, non-fat dairy on the side, or have that with breakfast. You can always have, one of those yogurts that I mentioned as a snack in between. You can have some fruit in between your meals as well. Next slide, please. So here's that picture. So again, you can see quarter of the plate. There's I think it's a chicken breast. The other quarter of your plate, maybe some rice or potatoes. And then you can have just a bunch of vegetables. So there's your fiber, maybe a slice of fruit or some, a fruit cup or mixed fruit, whatever's in season, sort of as your sweet treat after the meal. And of course, water. Take a look at how big is your plate. Maybe your plate is bigger than 9 inches. So that's something else I work on with people. around the holidays, if, you know, there's buffets and just so much food and snacks, maybe, you know, choosing the smaller plate, try a little bit of everything, making sure you get good movement in on that day. All those things help. The plate can be in the form of a sandwich. You know, you have your bread, that would be your starch, whatever your protein choice in between, you know, the bread, healthy fat, some avocado, lettuce, tomato, onion, you know, kind of put a mini salad on that sandwich, and that'll work out well and keep you fuller longer. And again, blunt that post-meal blood sugar rise. Thank you. All right. So, if we have time at the end, we can go back and talk more about nutrition, but I can't do this talk without encouraging the activity. So again, for my folks with prediabetes and diabetes, activity is incredibly important. It helps with blood sugar control. So when I work with gestational women who are pregnant with diabetes, for them, after a meal, taking a 10 to 15 minute walk lowers their blood sugar. This works for my folks with diabetes, and I think it's just a great habit to get into, even for those with prediabetes. It also can prevent weight gain, reduces depression, and then also lowers your risk for all of those items listed below. Next. So how much activity do you need to do? We still recommend 150 minutes a week. This is equivalent to, you know, walking for 30 minutes, 5 times a week. You can split that 30 minutes. Say you're busy at work, you can do 15 minutes during your morning break and maybe 15 minutes in the afternoon or in the evening. That adds up to your 30 minutes. So really important. Or doing 10 minutes after each meal, 10, 20, 30, there's your 30 minutes for the day. You can check on your intensity level as well. So the more, if you're a vigorous exercise, you can see the time changes a little bit. I think getting activity in every day is really important, you know, however you can do it. If you tend to work from home, set a timer on your smartphone or your watch, try and get up and move for 1 minute, 1 to 2 minutes every hour. Next slide, please. We also know, besides that 150 minutes minimum a week of cardiovascular activity, we know now how important strength training activity is. So using those muscles by doing some sort of resistant training twice a week is really important to do, at least twice a week. I know a lot of people do a lot more. Some people don't do any at all. So trying to meet somewhere in the middle there. So, you know, doing that twice a week. You don't need to join a gym. They have exercise bands. You can get small little weights at home. Some of my patients do Pilates or yoga where you're using your own body weight for resistance. All of that works. So lots of ideas there as well. Next. So how can you increase your activity? For folks who are not very active, we try and look at what the barriers are for them. And what could be some solutions to those barriers? You know, like I said before, do you have to go out and join a gym? If it's something you don't like, you know, why spend your money? You definitely want to think that if time is an issue, that's where I think those 10-minute walks or movement that you can do after each meal is going to add up. So next slide, please. All right. So there is, you know, little ways before I get into stress where you can get little bursts of activity in. You know, you've probably heard a lot of these before: parking further away, taking the stairs, do an extra lap at the mall or around your office, use a bathroom on a different floor, you know, breaking up that activity. So however you can just move a little more throughout the day, very important. All right, I have to talk about stress. So stress can definitely increase your insulin resistance. And that's what we don't want to happen. There's, not a lot of good things come from being stressed. So high stress levels can definitely be a barrier to making healthy lifestyle changes. These are the different types of stress listed here below. And for a lot of us, we experience all three. Next. How do we manage our stress? What can you do to try and relax or manage your stress? So for a lot of us, we have to learn how to say no when a lot of responsibility is put on our shoulders, whether it's at home or it's at work. Again, perhaps your focus isn't going to be initially on food or nutrition, but maybe it's making time for physical activity. Moving a little bit more not only can help you manage your stress, bring down your blood sugars, improve your sleep, help with, any sort of depression or mental, anxiety that you may have. It's really, really incredible, when you stick with it, what it can do for the body. Make time to relax, whether that is reading, taking a bath, doing some deep breathing, exercises. I know that there's a lot of apps on the phone that help with that, or meditation. Really important. Sleep is extremely important. I can do a whole hour talk on sleep alone. So, ideally 7 to 8 hours a night. You want that to be as good quality sleep as you can. You can't save sleep up for the weekend. You really want to try and do this, like I was saying, every single night. If you're only getting 4 or 5 hours of sleep, maybe try each week to add a half hour to that. Definitely shutting down digital devices and the television, and doing things that will calm and relax you before bed. And of course, making time to laugh. That's just as important as everything else. Put a smile on your face, watch a program, talk to friends, play with your dogs or animals, whatever it is. So be sure to make time for humor and laughter as well. Next. Just quickly, I think we might be running out of time here. And if hopefully I have a little time for questions, but the metformin that I mentioned before, and perhaps you have prediabetes or newly diagnosed diabetes and your doctor has talked to you about it. Like I said, it's a really great medication. It reduced the risk of developing type 2 diabetes by 31%. For a lot of folks, it provides appetite control. So it kind of blunts the appetite a little bit. So we may see weight loss for people using this. And it should be recommended as an option for the high risk folks that I have listed here. So history of gestational diabetes, a high BMI, under 60 years old, and we see the rising hemoglobin A1C despite how hard they're working on their lifestyle changes. So how does it work? It kind of shuts down that leaky liver. It turns the liver to stop releasing too much glucose into the bloodstream. Next. So in summary, I know I covered a lot of information here. How can I prevent type 2 diabetes? So if you are overweight, losing, again, think small, that small percentage. I have even seen a great improvement in blood sugars with even a 2% weight loss of where you're at. So, maybe look at what 2 to 5% loss would look like, what it is, and how to maintain that loss. That's usually one of the hardest things to do, is maintaining the loss. Eat healthy. Think fiber, think color, fruits and vegetables, whole grains, beans, legumes, lentils. Filling foods. Be active. So move more. Try and move as much as you can throughout the day. Get creative. Take the stairs. Take your stretching breaks. Take walks. If you can take a phone call or a meeting with your earbuds in and move around, very helpful. Try to find ways that you enjoy to be active, as well as ways to manage stress. And of course, the option of medications, especially if it's recommended by your healthcare provider. Next slide. So here are the resources. There's a lot of great ones out there. My favorite for all things nutrition would be the eatright.org under Academy of Nutrition and Dietetics, and heart.org. So that's the American Heart Association. They have a whole section on healthy living, which covers eating, activity, stress management, sleep. And like I was saying earlier, they have this, it's called Life's Essential 8, and they give you really wonderful tips on all the 8 areas where you can improve your health. So eating, activity, sleep, controlling your blood pressure, blood sugars, weight, cholesterol, and smoking information as well to stop smoking. So one of my other favorite resources for you there. And I think that's it.
Yeah, thank you, Claudia. It's Laura.
Sure.
Hey, I'm going to go over these next couple of slides regarding our wellness programs. If you want to chat some answers to some of the questions, as many as you can get to while I'm doing that. Again, everyone's going to receive a copy of this recording, a link to the recording tomorrow in case you had to jump off. But these next slides are for HealthNet members to help you stay on track. You can certainly find information on our wellness portal about diabetes prevention and many other resources. And don't forget to take the real age assessment. That's our health risk assessment, again, for HealthNet members only. And go ahead and check out our other wellness center programs. Next slide. We also have the telephonic support. So if you're trying to reach a health goal, working with a health coach may be something that you'll want to do, working one-on-one with them. And then, of course, if any of our members have a certain health concern, they can call our nurse advice line 24/7 to speak with a registered nurse. Next slide. We offer discounts for our members. So if you'd like information or discounts on things like weight management, like Weight Watchers, also with our chiropractic or acupuncture services, you can also receive discounts on eye care. So for instance, if you need another prescription sunglasses or so, hearing aids, and our fitness club discount as well. If you're not a member of HealthNet, just check with your health plan. They may have similar programs, services, and discounts. The My Strength program, this is our proven tools for mind, body, and spirit. So this is an online program that's also available in an app and gives you a lot of information on the go regarding managing stress, anxiety, depression. It has quick modules, quick videos on from mental health professionals, guided meditations, lots of different topics, including joy, laughter, positivity, meditation, mindfulness, relaxation. They have a module on COVID-19 as well as racism. Again, it's free for our HealthNet members. If you're looking for community resources, you can use Find Help. This is a social services resource and referral platform. It's a nationwide database of free and reduced cost direct services. We have lots of online challenges coming up next month. They're open to everyone. We have Winter Wellness. That's actually a 3-month, so that goes from December through February. We also have Beating the Winter Blues. That's a sleep challenge. We know the days are shorter, but you want to be able to be tracking your sleep just to make sure you're getting enough. Finding Balance is also a stress challenge. Now, with all the upcoming winter festivities, try carving out some time for relaxation. Can be really hard. So this is a great challenge called Finding Balance. We also have one in December called Protein Power. So this is a nutrition challenge. It helps you to focus in on healthy sources of protein in your diet. And finally, we have Walking in Winter and Fitting in Fitness. Those are both step challenges that'll take place in December, and you can see as a HealthNet member where you log in. If you're not a HealthNet member, you can see where you can log in as well at sharecare.com. last slide is our upcoming wellness webinar for December. That's called The Gift of Health and Gratitude. So we're going to be looking back at all the webinars we covered this year with some highlights on some key tips and takeaways. And we'll also focus in on thoughtfulness, thankfulness, and gratitude. So I hope you will join me for that. Thank you so much for your time today. And again, you'll receive a copy of the link to this recording tomorrow. Thank you so much, everyone. See you next month.
Thank you.